My name is Ly'jhia. I am 20 years old and I am from North Philadelphia, seeks to be more, 28th Street. And I just graduated from high school in November.
Good morning, guys. It's 6:50 in the morning. I'm getting ready for work. About to brush my teeth. And yeah, today's the COVID testing, my first one. I'm a little nervous.
A new storyline emerging and a very important one that they're dealing with the United States. The new data coming out that shows African Americans and people of color are dying in the pandemic, and it's just a disproportionate amount.
You know, health disparities in African Americans has been around prior to me graduating from medical school, and that was over 2 decades ago. So for me, in April of 2020, to hear the same thing I've been hearing for over 20 years, I said, I'm not doing it anymore. And that's why the Black Doctors COVID-19 Consortium was formed.
When the pandemic hit, it hit us all, literally. Stores are closed, markets are closed, everyone's very, very scared about how to move forward, and we were as well. And so we realized that, hey, we need to do something about this.
If you have any questions, please put me to the side. Right now, we start distributing at 4 p.m. on the dot. So we got 560 boxes of food. So if you know somebody who needs one, they'll come on down, and everybody will get turkeys, first come, first serve, but everyone will get a box of food, okay?
When it first started, I'm not gonna lie, I didn't take it serious. But once it really started spreading and getting worse and stuff, and then people closer to me caught it, it was like, okay, this is serious.
Yesterday was a huge success. We ended up testing, 487 people. That's an excellent testament to the work that we're doing, and we got to keep it up, okay? Today we're at Deliverance. Last time we were here, we had a huge crowd, and today, expect the same.
African Americans are dying and being diagnosed with coronavirus, specifically 2 times and sometimes 3 times greater than every other group in the United States. But no one talks about what the healthcare responsibility is improving health disparities in African Americans.
So we're going to need everybody to take like 2 steps back if you didn't come with the person you're in front of. We want to keep everybody safe out here.
This pandemic has exposed the have and the have-nots. Philadelphia is a city of poverty. When it started to hit the Black community and the brown community, it started to hit the Black and brown community.
I am, but I'm off on Fridays.
You want a new job?
We'll talk. Let's talk, because they just told me I'm cut. They just told me yesterday. Seriously.
When people talk about health equals wealth, that is absolutely important. People are getting laid off. People are getting furloughed, which means you don't make money. You can't pay your rent. You can't pay your mortgage. You can't buy food. That financial impact is really burdening our communities.
I have been working throughout this whole time.
Well, I'm back. Just got off of work. I'm so tired. I just want to pass out and go to sleep, but I'm gonna go get this COVID test done. Can you guys see that? Line is all the way up there.
To date, we have tested about 15,000 people. Of late, we've been testing 400, 500 people per session.
What number you said you was at again?
118.
118. I gotta wait out here for an hour or so. An hour to an hour and 15 minutes. They're calling people up by groups though, so that's the good thing.
I'm grateful we can offer it, but I'm not letting the hospitals off the hook. As a physician, a hospital, a healthcare entity, it is your job to help those who need help, to change those health disparities.
Okay guys, that wasn't as bad as I expected, but as you can see, my eye is watering.
We are all in this together, and we have to push forward.
We need each other. Unity right now is the biggest thing that we need.
It's not enough to say, well, we should have planned better. We should have more testing kits. You need to do something. And I'm at a point in my career now that I can be part of changing that story.